Ramesh, and he will share with us his work that he has been doing in Nagaland on the health front. Yeah.
Good morning. It's an honor to be here, and I feel almost embarrassing because I'm going to be talking about very basic stuff, and you guys are doing rocket science. But one of the main questions that I've been asked when I come here is, "You're a doctor. What are you doing here?" And I think this kind of is a story of how I got into GIS. I'm a public health physician from CMC Vellore, and this is I worked for 6 years in Nagaland, and these are some findings and how I got there. So this is Nagaland. You can see the topography of the state. It borders Myanmar on in the east, and of course the rest of northeast India. And you can see how hilly it is. So in 2015, I finished my MD community medicine, and I went there to work. I chose to work in Christian Institute of Health Sciences, and there, when I went there, the first thing that the director told me is that Tata Trust wants to do some projects in the border districts. So there are three border districts: Tuensang, Kifiri, and Pek, and they wanted to do something. So they wanted to have a needs assessment. What are the communities over there? What are their needs? Health needs, educational needs, and all that. So we did a sampling, and we decided to do this trip. And I traveled for about 20 days. We nearly 100 kilometers, 1,000 kilometers. And one thing that I did was I asked my HOD from CMC whether I could borrow his GPS device. Because one thing I wanted to tell the partners is that it's a difficult terrain. And when you look at this map, it just looks like any other state in India, but it's not. So I wanted to prove to them, so I didn't know what to do, but I just carried this GPS device, and you can see here, that's the route that we took. From Dimapur, went up to Mokokchung, because the road's better in Assam than in Nagaland, so we went up. Then we went here, and these were the different health centers and the villages that we went through. And what we did was we just spoke to different NGOs who were working there, the community leaders over there. Yeah, that's Mimi village, and we were the ASHA workers, all the other health workers in that village. Down is the village council. Each village has a village council that takes decisions. So in short, one of the light bulb moments was that in one of the areas in Huck, I just looked across and asked the taxi driver, how long will it take to go to Tuensang? So this is Tuensang, and how long will it take? And I made a guesstimate that it'll take about 45 minutes, because this is how it is, right? It's just about 7.6 kilometers, and in the plains you can go in probably 30 minutes, 40 minutes max. So I thought that, but in reality it took about 3 hours to reach there. And I was like, if a educated person like me, so-called educated person like me, is making such blunders, imagine a person sitting in, making policy decisions for this area. They must be making the same blunders. So, and that's what health needs. So this was the terrain that you can see. My entire trip, I kind of just download the device, from GPS device, and you can see how the terrain goes up and down. And I think I convinced the partners so much that it's difficult terrains that they didn't fund the project finally, because they felt that it was quite difficult. But this is what happens. This is a map of India, and each of the district, I plotted the delivery date, institutional delivery rates. How many of the mothers actually deliver in a hospital? And as you can see, the red areas are mostly North India, Northeast India, especially Nagaland, but there are also pockets here. And immediately you know that it's all mountain areas and the hills, probably even the forest areas over here. But South India is much better. But even in South India, in a state like Tamil Nadu, we did a project in Javadu Hills where it's 90%, but the district shows it's nearly 99%, but there are pockets even in a good performing state. So we realized that if you look at the NFHS data over here, Nagaland is even worse than the Indian mean, and you can see Tamil Nadu as a thing. So nearly 38.8, only 38.8 rather, mothers deliver in the hospitals, and only 13.1% of the mothers have 4 antenatal checkups. So when they're pregnant, they're supposed to have checkups, at least 4, and it's that. And only nearly half of the children are immunized itself. So one of the things that we wanted to find out, are there patterns in this? Who are the communities who have poor access? So we did a study, and this is, I chose the block, this is called the Perrin block. I chose because this is Dimapur, and when I looked in GMaps, I found that that's the closest block, so I thought, okay, I don't have to travel much. But in reality, when I went for my first visit, it took me 8 hours to reach there. So again, a blunder, but this Perin district, it's surrounded by Assam, Manipur, as well as Dimapur and Kohima are the two major cities where there's healthcare services, but this is so we went, I had two field workers, we went house to house, asked questions to any mother who had delivered in the last 2 years, any mother who had delivered in the last 2 years, and that's a field worker. That's a typical Naga kitchen, and that's how mothers take care of their child over there. So we collected waypoints, tracks, and we collected demographic information. This is a DEM of the district, and you can see that the southernmost part is mostly hilly as compared to the northeast and the northwest part of the block. These are the health centers over here, and this is also the road networks, as you can see. So it has, the main road is something, smaller roads generally look like this over there, but even the main road looks very much like this. These are the main health centers that have, but this is the main road. So you can see that it's quite bad as well. So access is quite difficult, and if from the southernmost part of the block to go to northernmost part of the block takes nearly 6 hours. So again, that's quite a different. Why is it important? Because if a lady has to deliver and if she needs emergency services, she has to go to either the district hospital or the CHC over here to deliver. Now, if we look at this point here, these 2 points look close to each other, and in fact, this health center is supposed to cater to this village here. But in reality, when I went there, I realized that it's not true, because there's a big river in between. So again, when you look from the top, it looks close by, just 5 kilometers, but it took me 5 hours to reach from the health center to that village, and we had to trek down the river. And that's also, you can't trek always, right? Because in rainy season, it's going to be difficult. So this is the quick summary of all the mothers that we did in the 4 blocks. And this is Tenning block, which is the furthermost block. I'm just quickly going through some statistics. Only 2% of the mothers in Tenning blocks actually had 4 antenatal checkups. And you can see some of them, even 18% of them, did not have any checkups at all. So I just plotted, I'm sorry, I'm going quickly because of lack of time, but I plotted and I did a hotspot analysis, GETIS-OD, and I found that there were some areas, especially in the southern part of the block, that had hotspots for no antenatal checkups. And similarly, if you see, so this is how that the southern part of the block looks, and it's quite hilly. And if you look at 4 antenatal checkups, that's which are the performing areas, you can see that there are certain centers that have performed well. So around those centers, they perform well. While there are some centers down here that aren't performing well, so you can use it as a proxy. Home deliveries, each of these dots are each village, and this is a proportion to size. So the larger the size, the more home delivery is happening in that village. And you can see a lot of clusters of home delivery. Nearly all of them deliver at home in some of the areas. And especially in Tenning, we found that 63.5% of the mothers actually deliver at home as compared to the Indian of 13.3. So here I did the same hotspot analysis, and we can also see that there are some cold spots. That means that these are the centers that are doing well. Even though there's a delivery point here, it's not a cold spot. That means we can use this as a proxy to say that some of the centers aren't delivering or people aren't going there. So these are all the hotspots, and this is the cold spot. I also did so if you're delivering in an institute, you think that probably they'll go to the closest center, right? Over here. So I plotted to see how far they travel to deliver. And then you realize that most of them actually don't deliver to the nearest center. They go all the way either to the CHC. And this is surprising, because the district hospital is closer than the CHC, but they go all the way to CHC. So many times when we look at nearest center, we think that the nearest center is functional, but maybe it's not. Or maybe it's also the preference that people actually might go to a lower center because manpower is available there 24 hours. So if I want to deliver, I'll be certain that somebody can deliver here safely and they can do a surgery, as compared to here, even in a district hospital where doctors might not be available, or they might not be able to do an emergency cesarean section. So many of them actually from here go over there, stay in relatives' house, and then they deliver. And I did that for all the blocks, and you can see over here one of the centers that are actually doing well here. So people prefer to go over there for delivery. And I did it for all the other blocks. This is the other block called Peran. This is the Atibung and Jaluki block. And you can see that a lot of them even go to Dimapur or Kohima to deliver because they aren't facilities or they're referred over there. So just because there's a closest center, you can't assume that that center is functional in a hilly terrain. And you can see how many of them actually go to the CHC, which is functioning over there. So this is just a rudimentary time travel modeling which I did, and I realized that this isn't actually true, and that is the reason I came here, because I wanted to learn like Python or other packages where I can change it a little bit. But essentially, if you need to deliver, this is the time travel. It takes more than 60 minutes to go to most centers, and if you need an emergency cesarean section, only a third of the block has access within 120 minutes. So I'm not sure whether this estimate is right, but I do want to kind of change the model, and that's the reason I'm here. This is where some of the home deliveries happen. This is the PHC. As you can see, it was closed, and when we went there, they opened it for us. And this is how the delivery rooms look in most places. Similarly, for childhood immunization, we realized that there are a lot of areas with similar to the other hotspots. And when I overlaid it, then I found that there are some patterns, and could we actually predict places with low access to healthcare services even without going there? So once I saw that, I started working on a proposal, and the proposal was to try to find out a geographical risk stratification for hilly areas, and this is funded by India Alliance, and hopefully we will use different sets of data, and this is what I'm doing right now. We've taken 8 blocks in Nagaland and 2 blocks in Tamil Nadu, using Tamil Nadu as a good performing state, Nagaland as one of the lower performing states, and using different features to create the model. So geographical risk stratification model is what we're trying to do with this whole thing. Thank you for listening, and happy to take any questions. Sorry for rushing like that. These are some pictures of our present study that we're doing. This is a landslide area. We had to wait for 5 hours to go to the village because there was a landslide right in front of us. Very common problem in Northeast India.
Thank you so much, Rohan. I think this is a really, really very useful presentation. It's a very, very useful presentation. This is real important work on the ground. So, yeah, I'll definitely talk to you. Any other questions? Yeah.
Especially, I have worked in the Northeast for quite some time, and I know the challenges. On the map, it looks like we'll reach this place in 2 hours. But it usually takes 6.5 to 8 hours, even with the Border Roads Organization doing their best. Yeah. So I can imagine the amount of work that you have put in, and more importantly, translating the data to find patterns and stuff like that. And I'm sure this will be very useful for the government for their next steps. Thank you very much.
Thank you, sir.
Thank you.